Nilesh
So,
Kumar, Dr. Nilesh Kumar
yes,
is going
sir.
to speak on direct imaging of gonioscopy by smartphone. Nilesh, you ready?
Yes, sir. I'll start, sir.
Yes, please. Press, please.
Thank you so much. Good evening, everyone. I would like to thank AIOS for providing me an opportunity to present my work, Direct Imaging of Goniomirror by Smartphone. I'm Dr. Nilesh Kumar, and these are my financial disclosures. Gonioscopy is one of the most difficult clinical skill to be acquired, and thus even in majority of glaucoma clinics is not performed at baseline. In this letter to the editor, we raised the question that most of the recent advances in anterior chamber imaging, the surrogate to gonioscopy, are not cost effective and easy to perform. Raising question is important, and so is finding a solution to it. We innovated a novel technique using just a 4-mirror gonio lens and a smartphone, which was validated on 65 eyes and was published in the Journal of Glaucoma, and it also made it to the cover art. But how it began, just as a jugaad, this is the first ever image taken by DIGS, and you can see the amount of improvement it required. The middle image, taken with a transect lens, acting as a macro lens to allow for more details to be captured, and the last image is the macro lens being stuck to the camera. This is a long way from what we wanted to achieve, but the path was always exciting. We tried at least 12 different macro lens setup before achieving what we wanted. Once the macro lens setup was finalized, the device slowly began to look like a decent product. There have been 6 different prototypes before we could find a solution that fits majority of smartphones and gonio lenses. Finally, the device, which started as an idea in November 2018, was shipped as a product that can be used by everyone in September 2020, just 7 days before my DNB theory exams. And this entire journey would not have been possible without my mentor, Dr. Ashish Sharma sir. His own journey is an inspiration, and his guidance to prevent me from making his mistake has made the device what it is today, which is DIGS Pro, one of its kind, frugal commercial device in the process of patent application, which is compatible with 2, 3, 4, or 6 mirror gonio lens and smartphones with single or multi-camera setups. This is how the device is set up for use. We place the gonio lens in the adapter, which by design aligns centrally with the optics of the smartphone holding segment, where the smartphone, Android or iPhone is snapped fit. Normal camera app or the MI Red Cam app can be used for clicking the image. The lens with the holder is applied in a normal fashion under topical anesthesia, and the patient is asked to look straight. The smartphone segment aligns beautifully with the lens adapter, and you just click using camera flash. As simple as that. These are few sample images using Vogue 4 mirror lens and few images using Ocular 3 mirror lens. In the validation trial for the device, where out of 280 images, 89% were found of credible quality, the kappa coefficient between slit lamp gonioscopy and the device was 0.65, while between 2 was 0.82, both implying substantial agreement to classify open and closed angle glaucoma. We also recently concluded a patient education trial on 200 patients, where 56% of the patient agreed for YAG PI when counseled verbally, but when shown their angle status using DIGS Pro, 93% agreed for prophylactic laser. As we went ahead on the journey, we realized the device use case went beyond what we had intended. When coupled with a slow motion videography, the dynamic nature of the angle can also be visualized in the angle closest aspect in a more physiological manner. Here we can see the angle slowly open up when the pupil constrict in response to the flash. It also doubles up as a diffuse anterior segment imaging device, which due to its inbuilt optics. The companion MI-RedCam app allows us for easy record keeping, teleconsultation, and also gives us an opportunity to collaborate with various research projects. One such project is to create a repository using DIGS Pro images, which can create an AI overlay in the app itself. So when a technician clicks an image, he will get a notification whether to refer to the patient to hospital or not. But have we done all we could have done with the device? Not at all. The beauty of innovation is the next frontier to achieve is the reflection-free
You have
image. We are experimenting with various polarized light, filter and external flashes to provide a reflection-free 360-degree image, which hopefully will be available soon. But all this, have we solved the problem? I'm not satisfied at all, as the problem of acquiring the skill of gonioscopy still persists. And that is because we do not have a proper dry lab equipment that can allow the resident to practice their skill. So we have embarked on a journey to create an AI that allow for an entire clinical exam when mounted on a slit lamp Our audacious aim: single practice eye for anterior segment evaluation, fundus evaluation, gonioscopy, as well as aplanation tonometry. The first image obtained from the practice eye is eerily like the first image obtained from DIGS, and we take it as an indication to pursue till we succeed. That's what we imagine. So keep imagining, keep innovating, keep translating, and keep digging. Thank you so much. This is Nilesh Kumar signing off.
Thank you, Nilesh. I think that was a very nice presentation, and on a topic of gonioscopy, which is so very difficult to get images, is very difficult. And I think very well done. And the fact that you're still continuing on and on now with the eye model, I think with the in experimental situation, I think makes it even more even greater. So anybody would like to comment? Suven, are you there? Yes.
Yeah, I'm there.
Dr. Lalit Verma, sir, would you?
The beauty before Suven comes, because Suven will ask very technical question, but you see, I like this idea of dig pro, keep digging further. The most useful part which I thought was, Nilesh, that once you showed it to the patient, the conversion rate of YAC-PI converted from around 60 to 93%. That was one thing which I would like to take it forward, because that is the ultimate aim. You see, like I show my fundus photograph to the patient and tell him like diabetic retinopathy ye hai, what we need to achieve is this. So here is the photograph which you show, and patient gets convinced. So good job.
Thank you, sir. Thank you, sir.
Yes, Suven.
Absolutely agree, sir. And Nilesh, I've seen this presentation many times, and the presentation seems to be getting better every time. With your video and the images, I can see the refinement in the quality, and that's progress. And like Lalit sir said, yes, seeing is believing, and showing is again making people believe. So I think we're seeing something good coming. And like you said, and I think it's more important, as you found where the problem is to educate the people to do it. So standardization of that and training. So you're on the right track. Thank you for your presentation.
Thank you, sir. Thank you so much, sir.
Wonderful presentation, Dr. Nilesh. Very nice.
Thank you, ma'am.
We'll find its use.
Thank you, ma'am.